Now joining us live tonight to further discuss the drop on restrictions is Dr. Scott Miscovich with Premier Medical Group Hawaii.
Dr. Miscovich, thanks so much for your time tonight. We appreciate it. But so what are your initial thoughts on dropping foreign travel requirements?
Wow, concerning is the first thing I would say. This is another example how at the federal level, public health has finished third. Business interests, when it comes to the airline industry, who has lobbied the federal government and the tourism industry, then the political world, and public health interests are third. This is very concerning because, again, we're far from seeing the end of this pandemic, and we have different variants now are starting to pick up that are much more contagious. So one of the things that we're looking at is, why is this disease surviving? It's because so few little droplets can get in you and can cause infection. So that BA5 is what we're really seeing lurking now in both Portugal and the United Kingdom and different areas across the country. We have 8 positives here now in our state. And they're so easy to get that if you combine no masks with no testing, an airline travel to Hawaii with the distance we have could be a super spreader event. And so it's very concerning. My advice to the people of Hawaii, if you're going to fly, wear a great N95 mask and don't take it off. Very important. That's the best you can do.
Despite that warning, this past week in the DOH's weekly COVID-19 report, it did show a slight drop in cases. Any chance that we're starting to plateau here in Hawaii?
I think we have plateaued. I think if you go back to some of the things that we've been talking about here on your show over the last 2 months, we were predicting towards the end of the month would hit a plateau. And I do believe it will start to go down, but it's probably not going to go to a full dip because we're watching the BA4 and BA5 and then BA5.1. So there are new variants that are starting to pick up in different areas across the world that are more contagious. And yet I do think we're going down, but remember, we still don't know. We're basically, not counting the home tests, and most of us still believe that we're looking at anywhere from 5 to 8 to 10 times the number of positives still in our community. So please don't let your guard down.
And, COVID-19 vaccines for kids, young kids, could get final approval very soon. So what would this mean for us here in Hawaii?
It's positive for kids and parents all over the United States. We're anticipating the first shots in the arm will go in June 20th, somewhere, a week from next week. It really looks like it's positive that it's going through unless something changes. We have both Pfizer and Moderna that are approved. Now, I will highlight that a Kaiser Foundation study, which is probably the most valid study we have, predicted only about 18% of Americans would have their children get vaccinated. So if that's any indication, I'd say Hawaii is probably going to be a few points higher than that. But the bottom line, my advice to parents is, if you have a child who has even any moderate degree of risk, i.e. asthma, any immunosuppression, any recurrent health problems, one, of course, talk with your doctor, your child's doctor, but those are the kids that really should be lining up to get those shots. And I mean, I'd advise them for all the children, but the bottom line is a lot of work is going into the safety of this vaccination, and it has proven extraordinarily safe for the children. And again, it will be out, and everything is 2 shots for Moderna or 3 shots for Pfizer. People ask me all the time, probably edge on Moderna because of that.
On a personal note, doctor, I actually tested positive last week for COVID-19. I was fully vaccinated, fully boosted, only had mild symptoms. But one thing I was trying to decide was whether I should try that antiviral drug, Paxlovid. What would you have recommended?
Well, without knowing your full medical history, but since I do know you fairly well, I think you're healthy as a horse. And so typically Paxlovid we would give to people who have some risk and some healthcare risk. Now, the risks that are understated are obesity. If you weighed over a certain amount of weight, not saying you do, Rick, I know you're nice and svelte, but that's one that if you're over a certain weight, if you're diabetic, if you have high blood pressure, heart disease, certainly if you have asthma or lung problems, boy, you should be on it in a second. But here is the big thing that's happening across the United States. It should be initiated 5 days from your onset of symptoms. When you put in the delay of how long it takes to get a test and then to contact your doctor and get the information, we already start pushing up to that window of being too late to get it. But anybody who has remote risks, another factor is if you do a home test, you are eligible to get Paxlovid. It does not have to be followed up with a PCR. That's a big misnomer out there right now. So, that's really good information that you're bringing, Rick, because it could help a lot of people who should be seeking it out. The other one, real quick, is monoclonal. If you're really sick and you've got cancer or something like that, there's the injectable or IV form, which you can get, and that has to be done immediately, life-saving medications.
For the record, I wound up taking it. I think it helped, but it did leave a after effect in my mouth that I really hated. But anyway, I thought to be safe, I'll take it.
I think a little water won't clear up, right?
Well,
patients tell me it tastes like gunpowder. Yeah.
Yum.
It has the elixir of gunpowder. I don't know what that tastes like, but that's okay.
All right, Dr. Miscovich, we have one more question before we wrap up really quickly.
Sure.
Monkeypox, how concerned are you about it? So far, the state has reported 3 probable cases.
Well, I've been involved in this, and I do have my certifications in monkeypox. I'm concerned in a sense that we've let this disease get legs across the world. This is not going to be another pandemic by any means, so I'm not concerned in any way like we have been for COVID. But we are taking a chance that we are going to let this disease become endemic in our country. The worst thing that could happen to our country right now is if this shifts from a human and gets into an animal vector, where if it gets into the rats or gets into squirrels or some rodent, which is where it lives, so then it's permanently living in our country. Otherwise, the disease is fairly self-limiting. It's not that bad. You get a rash, you might get some fever and achiness and some swollen lymph glands. It can go on for a little longer than COVID. Mortality rate is much lower. So it takes a lot longer to spread. Another misnomer on this disease is what the CDC cleared up today is masks aren't part of protecting. This is direct contact primarily, and you have to be really close to someone to get respiratory droplets. So it's almost always physical contact, sheets, pillowcases, towel surfaces, much more involved in this. So the person-to-person contact is where you get monkeypox. So wash your hands on this one for sure.
Well, thank you so much, Dr. Miscovich. As always, we really appreciate you stopping by tonight for your insight. Thank you.
Thanks for having me. Hope you're doing better, Rick.
Okay, I'm back at work, so I tested negative. All right, thanks, doctor.